For many couples, starting their own family is a very difficult process, but you don't have to struggle with infertility because there are many treatment options that are available, and we've got Dr. Porche with Lake Area Medical Center here to shed some light on what's really a very personal struggle for a lot of couples.
Yeah, infertility can be very difficult, and the first step is definitely going to see your doctor and starting to tease out what it could possibly be.
Well, let's talk first of all about what infertility is.
So infertility is when a couple, not one person, but a couple, has had difficulty or failure to conceive in 12 months. But after the age of 35, in a female, it's difficulty to conceive or failure to conceive after 6 months.
Okay, so those are some of the difficulties for females. Are there other difficulties that might just be a target for women?
So whenever you break down the causes of infertility, unfortunately the number one cause is unexplained, which likely means there's more than one thing going on. But secondary to that is actually male factor infertility, and after that is ovulatory dysfunction, and then there's several different things that could be going on that are structural, whether it's with the cervix, the uterus, or the fallopian tubes. And also with different diseases, including endometriosis.
Okay, and for men specifically, you were saying that we can blame them for one more thing.
Well, so whenever the number one symptom of infertility is actually failure to conceive, but there are some things you can watch out for. For men, it's probably low energy or lack of desire to have intercourse, or some keys to that something else may be going on.
And so we want to watch for those things. When would be the best time for a woman to see a fertility doctor?
So I think it's really important to go ahead and see your doctor when you're thinking about conceiving, just so you can get preconception counseling. But after 6 months of trying, I think it's really important to go ahead and go in and go for the infertility discussion.
And start having those conversations. What kind of treatment options are available for couples?
So the first thing is just getting a good history and physical, going and back and looking at the history of the male and the female. After that, we do some more testing. We do semen morphology and volume, and look at the semen a little bit more closely. Look at the uterus. Further beyond that, you can do diagnostic testing with either laparoscopy or hysteroscopy, and do some ovarian reserve testing as well.
All right, a lot of options that are available out there for folks to be able to start their families if they're having difficulties, and we've got the information on the screen for you to be able to give Dr. Porche a call if you've got any questions. Thanks for coming by to talk to us about it.
Thank you so much.